Smart investment in water, sanitation, and hygiene helps change lives, helps save lives, and helps economies recover and prosper. The Sanitation and Water for All Partnership, together with UNICEF, the World Bank, the African Development Bank, and African Ministers' Council on Water, welcome you to this important global meeting. Thank you for joining us. All around the world, investment is making difference. In Vietnam, tourism benefited.
Thành phố Nha Trang là một trong thành phố trọng đầu những năm 2000 đứng trước cái cơ hội thuận lợi mới để phát triển ngành du lịch của tỉnh Khánh Hòa. Thì lãnh đạo tỉnh đã chấp thuận cái dự án đầu tư về cái cải thiện vệ sinh môi trường thành phố Nha Trang cái giai đoạn 2007-2014. Trong đó đặc biệt năm 2019 vừa qua thì Khánh Hòa đã đón 6,2 triệu lượt khách du lịch, trong đó trên 3,6 triệu lượt khách quốc tế và doanh thu của ngành du lịch đã đạt 27.200 tỷ đồng.
In Nigeria, water, sanitation, and hygiene initiatives continue to have a positive impact on education.
So, since the intervention of WASH, the population of the school has been increased from 152 to 245. The academic have been improved because some of them used to run home before, but now there was no diseases. They stay in their classes.
In Brazil, economic investment would benefit society.
Quando a gente olha para o Brasil, a gente percebe que aproximadamente 100 milhões de pessoas não têm acesso ao esgoto tratado. Quando a gente olha para pessoas sem água, nós olhamos para uma população equivalente a 35 milhões de pessoas no Brasil. Se a gente imagina, criasse uma situação hipotética de Brasil saneado, uma meta a ser perseguida, aonde remontam investimentos da ordem de 450 bilhões, retornariam à sociedade algo superior a 1 trilhão de reais.
In India, clean water projects change lives.
Earlier, collecting water was a big headache for all women. We couldn't take any job because we were waiting to collect water, which could be delivered at any time. Because of this, the school attendance of children was also affected. After this project was approved, the overall economic status has improved. Now we are able to send our children to school all the time.
Global and regional partnerships are vital.
The African Development Bank invests in water supply, sanitation and hygiene due to their centrality to poverty reduction, the achievement of socio-economic development objectives for Africa, as well as achievement of the SDGs.
I urge finance ministers and heads of state to take water as a priority topic and take it to the top of their policy agendas. Only in this way would we prevent a complete negative impact on the health of populations and the economic development of nations.
Investments in basic water and sanitation services in developing countries have been shown to have benefit to cost ratios as high as 7-to-1, according to the OECD, because of their positive impacts on health, education and nutrition. The benefit to cost ratio can be raised even higher if wastewater is treated as a resource and recycled.
Today, you have the chance to make a difference. Investing in water, sanitation, and hygiene has never been more important. Together, we can reduce malnutrition, liberate women and girls, boost economies, increase school attendance, mitigate climate change, and improve healthcare worldwide. Be part of the conversation. Be part of the solution.
Dear co-conveners, heads of UN agencies and other agencies, dear partners, excellencies, dear friends. It is my great pleasure to welcome you all to the first of the 2020 series of 3 virtual regional SWA finance ministers meetings. It is a great pity that we are not able to meet in person due to the pandemic that is making all our lives so much harder. We are, however, glad that this has provided us with an opportunity to hold online versions, which allow for more people and specifically more ministers to join the conversation. Today, we are breaking records. We are also mainstreaming this meeting live and hence reaching many more people than we usually do. The meetings are co-convened by SWA and some of our key partners, globally with UNICEF and with the World Bank Global Water Practice. And regionally, we are also co-convening this meeting with the African Development Bank, as well as the African Ministers' Council on Water. And we will hear from representatives of all these partners very soon. Before we start, let me get the housekeeping out of the way. This meeting will be held in 4 languages: French, English, Spanish, and Portuguese, with simultaneous interpretation between the 4 languages. For those of you who are speaking and making interventions during this meeting, you have already been briefed on your language settings. For those listening in, you will have selected your language when you logged in. There are also closed captions in English, Spanish, and French at the bottom of the screen. If you have any problem, please write in the chat box of the platform that you are using, and we will help you. We have only 120 minutes for this meeting, and we want to have a lively exchange of ideas. So I would like to urge you to keep your interventions to short and meaningful ones, in order to allow as many people as possible an opportunity to speak. We will prioritize ministers, of whom I believe 52 are joining today, between sector and finance ministers. So, with the housekeeping done, welcome to the honorable finance ministers and distinguished speakers, and welcome to all the finance ministers, distinguished speakers, and all the honorable 50 ministers and others representing over 30 countries across Africa and across the world who are listening in to this meeting. We are very honored and very happy to have you with us today.
This meeting is a question for an exchange between the Minister of Finance on the question of water, sanitation, hygiene for health and economic development. Despite the difficulties that we have encountered today, during the 7 or 8 last months, water, sanitation and hygiene have an increasing importance to give service for access that can be sustainable for everybody.
For those who are joining an SWA event for the first time, welcome.
We all have had a long path. The ministers of finance and their teams are more than ever invested in water and sanitation issues, as we can observe by the record numbers of participants in this meeting, as well as the intense preparatory meetings before this meeting itself. The ministers of finance, especially in the context of our pandemic, are aware of the importance of water, sanitation, and hygiene for the health, for the society, and for the economy. And it is in your hands, my dear honorable ministers of finance, to support the ministers and the sectorial ministers to create and maintain the necessary partnerships to guarantee investments and more intelligent investments in the sector. And it is also in your hands the possibility of opening the difficulties that might stop investments in the sector. For instance, we should drive tariffs and subsidies to support a more efficient sector support, as well as accessing green projects.
We are happy as the ever-expanding SWA partnership to set up a platform that brings you together so you can learn and exchange among each other now and in the future. Our partners know that actions speak louder than words. More than 50 governments and several civil society, donor, private sector partners have tabled more than 300 commitments in the context of our partnership's mutual accountability mechanism. We invite you, distinguished finance ministers, to join your sector counterparts in resourcing the achievement of these national-driven commitments. I will now introduce the speakers making the opening remarks and then hand over to our moderator, Dr. Canisius Kanangiri, who is the Executive Secretary of AMCAO, who will introduce the main event and the three country practices from Kenya, Zimbabwe, and Egypt that we are going to hear about today. We are very fortunate to have so many high-level speakers today to open the meeting, and we will start with a short video from UNICEF's Executive Director, Ms. Henrietta Fore, who could not be here today due to time difference issues. But she has made a video, and this will be followed by a few remarks by UNICEF's Deputy Executive Director, Mr. Omar Abdi. Ms. Henrietta Fore is, as you know, the Executive Director of UNICEF. She has worked to champion economic development, education and health, humanitarian assistance and disaster relief, in public service, private sector, and non-profit leadership. And some of her roles have included serving as the administrator of the U.S. Agency for International Development. Please show the video.
On behalf of UNICEF, welcome everyone to this virtual finance ministers meeting. UNICEF is proud to be standing here today with Sanitation and Water for All, the World Bank and our other convening partners, and of course with finance ministers from around the region. This meeting brings us together at a unique moment in history. The challenges facing us are stark. Even before this pandemic, too many people around the world lacked access to wash services. Now the COVID-19 pandemic has exposed these weaknesses and inequalities in a dramatic way. Inequalities are deepening, and with a global economic recession on the horizon, governments will be under enormous fiscal pressure. They may not be able to fund social programs to the extent needed. This represents a huge threat, not only to development progress, but to social stability. A lasting, sustainable, and peaceful recovery depends on using this extraordinary moment to reimagine a better, more equal world. As we recover from the crisis, WASH can be an equalizer, helping to ensure the recovery benefits to all people, not just the lucky few. Finance ministers can lead this shift by working with sector ministers to develop financial policies that support lasting solutions for water, sanitation, and hygiene, policies that maximize value from existing public funding, that mobilize additional funding to fill chronic gaps for water and sanitation, and that gather more partners around our work, including the private sector. So during today's meeting, let's work together to develop and deploy investments and solutions to ensure safe drinking water, sanitation, and hand washing. A smart and necessary investment toward a better, brighter, healthier future for every child and for all of us.
After these inspiring words, I would now like to invite Mr. Omar Abdi, who, as I said, is the Deputy Executive Director of UNICEF for Programs. He oversees UNICEF's global humanitarian and development programs, and he will make now some remarks. Omar, up to you now.
Thank you, Katerina. Excellencies, ladies and gentlemen. As Executive Director Henrietta Fore said, we are today discussing an urgent and important issue: how to increase financing for WASH during and beyond the recovery from the COVID-19 pandemic. We all recognize that water and sanitation are human rights. We agree that investments in universal access to water and sanitation can have a catalytic impact on other sectors and national priorities. Our progress in health, education, employment, gender equality, food security, and the environment also depends on our progress on water and sanitation. But as we meet on the 10th anniversary of the recognition that water and sanitation is a human right, the world remains significantly off track towards our goal of universal access. Africa, in particular, faces a range of challenges across the continent, challenges that are preventing communities and countries alike from building healthy and sustainable futures for their people. First, water scarcity threatens more and more countries each year. We are witnessing increasing competition for scarce water resources. This situation demands new solutions and new approaches, including better water governance and more efficient management to adapt in the face of a changing climate. We also need technological and community solutions to treat and recycle water, making every drop count. Second, the region is off track to achieve the SDG target of universal access to safe sanitation. Sanitation is a public good and requires public funds to ensure equity and safe management of waste. Far too often, these investments are not being made. And while the cost of universal access to sanitation is very high, we believe that inaction brings even greater costs, measured in lost productivity, rising healthcare costs, and pollution. I'm happy to note that African countries have recognized this and signed the 2015 Ngor Declaration on Sanitation and Hygiene, committing 0.5% of their GDP to sanitation. But clearly, we need to do more. A recent UNICEF study estimates that countries in sub-Saharan Africa collectively need to spend 2.5% of their GDP to extend safe sanitation to the unserved. A substantial proportion of investments must be specifically targeted to reach the poorest and most vulnerable populations. Third, the importance of hygiene for disease prevention has received greater attention than ever before. New initiatives such as the WHO, UNICEF, and Hygiene for All initiative need to be properly resourced in countries. We must sustain gains and build on them far beyond the COVID pandemic. This work and investment must start now. Fourth and finally, WASH in institutions like schools and healthcare facilities has become one of the issues of our time. This is critical to recovery. Without WASH, schools cannot safely reopen, and health facilities cannot prevent the spread of infection to healthcare workers and patients. Even before the pandemic, 1 in 3 schools lacked basic sanitation, and 2 in 5 schools lacked basic hygiene, affecting millions of children worldwide. Similarly, 1 in 4 healthcare facilities lacked basic water services, while 1 in 5 had no sanitation services. Taken together, this leaves millions of people, those who come to a health facility to get better, at risk of falling sick from other illnesses. The costs of providing basic WASH services in healthcare facilities is only a fraction of what could be saved from the human and economic costs from poor access to water, sanitation, and hygiene. It's an investment we must make. Across all of these areas, Excellencies, UNICEF calls on ministers of finance and all of our partners here today to come together and find new ways to finance and scale up universal access to safe water, sanitation, and hygiene. Throughout, our teams across Africa and around the world are here to support you. Let's work together to make this vision a reality for every country, every community, every family, and every child. And I thank you.
Thank you so much, Omar, for your intervention, for your inspiring intervention, and for reminding us that we must make the rights to water and sanitation real. but also that we can count on UNICEF with your experience and dedication to the WASH sector. And thanks for the call to action to find new ways to bring more finance to the sector and make smart investments for water and sanitation. It's now my great pleasure to hand over the floor to Dr. Tedros Ghebreyesus, who has been WHO's Director General since 2017. And prior to this, he served as Ethiopia's Minister of Foreign Affairs and Ethiopia's Minister of Health. While he was Minister for Foreign Affairs, we had the great honor of having been hosted by him in Addis Ababa in one of SWA's sector ministers' meetings. Dr. Tedros will make the case for water and sanitation to protect our health. Dr. Tedros, the floor is yours. Dr. Tedros, you are still muted. Dr. Tedros?
Now?
Yes, now it's perfect. Can you select the English channel?
Yes.
Perfect.
I was listening
it's
carefully.
Good. It's good. Yes. It's perfect. Go ahead. Thank you so much.
Thank you. Thank you for your kind introduction, Madam Chair. And very nice to join you again. Excellencies, ministers, dear colleagues and friends. It's an honor to join you today. These discussions between health, water and finance ministers are among the most important meetings of the year. Investing in water, sanitation and hygiene is critical to preventing both pandemics and local outbreaks. Its absence leaves us exposed. In fact, one of our most fundamental public health measures fails in much of our continent and around the world because hundreds of millions of people cannot wash their hands. That includes health workers in 1 out of 3 healthcare facilities globally. You already know the basics. WASH is the first line of defense against COVID-19 and so many other diseases such as diarrhea, cholera, typhoid, malnutrition, influenza, and pneumonia. It's also critical to preventing the spread of antimicrobial resistance, which is one of our biggest global threats. Without WASH, we're vulnerable. This fundamental science has been known for decades. Nonetheless, inequalities in coverage of water, sanitation, and hygiene have persisted. COVID-19, like many other diseases, thrives amid the inequities in our societies and our health systems. The pandemic reminds the world of a fundamental tenet of public health. When some populations are unprotected, it leaves us all at risk. Underinvestment in WASH has left 800 million fellow Africans without safe drinking water and more than 700 million without basic sanitation or the means to wash their hands. Thankfully, so far, African countries have been less affected by the COVID-19 pandemic than most other regions. But the lack of adequate water, sanitation, and hygiene leaves many communities vulnerable to this and other pathogens. Globally, we are alarmingly off track to deliver on our commitments to Sustainable Development Goal 6 for water and sanitation. Sanitation is especially lagging. At the current rate of progress, we will be in the 22nd century before sanitation for all is a reality. To achieve the 2030 goals, the rate of progress for sanitation needs to quadruple. WHO and UNICEF, as Omar said, will soon launch the State of Sanitation report, which sets out a path for investment in governance, financing, capacity development, data, and innovation. Investments in WASH are what we call a no-regrets investment, which support human rights and save lives. In fact, WASH is an excellent investment. The economic benefits of sanitation are about 5 times the cost, and improving hand hygiene can generate savings in health expenditure up to 15 times the cost. As I mentioned earlier, 1/3 of healthcare facilities lack access to hand hygiene at points of care. Unlike so many things today, this is a solvable problem. The cost of implementing hand hygiene strategies in healthcare facilities range from $90 to $2.50 per capita per year. Ministries of Finance should prioritize no regrets interventions such as this. Investing in water, sanitation, and hygiene is the necessary foundation for a healthy and productive population. WHO is assisting countries to track funding for wash services. This is critical because, of course, water, sanitation, and hygiene are not a one-time investment. They require sustained funding and critical and careful management. We cannot repeat the mistakes of the past. WHO is a global public good, WASH is a global public good, and as COVID-19 has shown us, we have no time to waste. We have to get it right. With sustainable public investment, transparency, and accountability, we can make safe water, sanitation, and hygiene a reality for everybody in Africa and around the world. I thank you.
I thank you also, Mr. Director General, for your statement and for your words of encouragement, also for reminding us all, and importantly, the Ministers of Finance present here today, that WASH is a no-regret investment. Thank you so much. And it is now my pleasure to introduce to you Ms. Mari Pangesto. Ms. Mari Pangesto is here representing the World Bank, and she took up her new role as the World Bank Managing Director for Development Policy and Partnership in March this year. Ms. Pangesto will provide us with inspiration regarding the global developments in financing for the sector. You have the floor, Madam.
Thank you, and good morning, good day to all of you. I would like to thank all the finance ministers for joining us today, because it shows your leadership and our collective commitment of the achievement of universal access to water and sanitation. The World Bank welcomes being part of this important sanitation and water for all partnership, and especially at this time when water and sanitation are central to combating the COVID-19 pandemic, just as we have heard from Dr. Tedros just now. With the world largely in lockdown, awaiting the development of a vaccine or an effective treatment, hand washing is the first line of defense for humanity. Yet, while people around the world are being told to wash their hands thoroughly and frequently, 3 billion people who don't have access to water cannot do so. And 2 out of healthcare facilities across the developing world do not have hand washing at point of care. That is why our immediate health emergency response, which has reached over 100 countries, we align with UNICEF and WHO to include 3 water, sanitation, and hygiene, or WASH, priorities. Safe wash services in healthcare facilities for patients and healthcare workers, improving hand washing behavior everywhere, and emergency support to secure the continuity of service providers and utilities. Examples of our support in Africa has included working with the Ministry of Health in Ethiopia and the Addis Ababa Water and Sewage Authority to ensure all healthcare facilities have around-the-clock access to water. In the Democratic Republic of Congo, we are supporting a communications campaign about the importance of hand washing and physical distancing. We will continue these efforts in our current $160 billion financing of the Relief and Recovery Program for our client countries for the next 15 months. As finance ministers, you can well appreciate the evidence that investing in WASH is critical to health, economic growth, and the environment. As Dr. Tedros mentioned, this is a no-regrets investment and will be key in this current emergency state, as well as in the recovery stage. These investments are about preventing 1.6 million needless deaths per year, investing in people and transforming lives. Reopening of schools safely cannot be done without proper WASH facilities, which will not just contribute to dealing with the current health emergency, but will have longer-term positive impact on human capital. Poor sanitation and water is the second and third leading causes for stunting, which has irreversible effects on the child's cognitive ability. From my time in government as a sector minister, I know that I had to convince the finance minister about the return on investment and the impact of financing. Our studies show that investing in WASH creates a return of over $4 on every dollar invested and can create and sustain millions of jobs. So not only does the provision of WASH creates jobs for engineers, plumbers, masons, utility managers, and other service providers, water is a critical input for productive activities, including for agriculture, SMEs, and large industries. So investing in WASH is really a critical part of our health response, which will be part of a safe opening up. And that is also about economic recovery. And will also create long-term returns for human capital, reduce inequality, create jobs, and expands opportunities throughout the economy. So other than the economic case, of course, we need to also have a conversation, and hopefully this platform will help us do this, that there are solutions and practical models out there to follow. And we are proud to be associated with the Indian Swachh Bharat mission, where political leadership and public financing has shown the world how safe sanitation can be delivered at massive scale in a short period of time. Many African countries are now taking up the challenge of scaling up WASH, and I look forward to hearing the examples that will be presented today and the opportunities to listen and learn from each other. The time to act is now, as all of you have been calling for, through bold and comprehensive country programs. We recognize 4 conditions for country-level success. Political leadership at the highest level, and I think we have a quorum here today on that. Public and private finance to meet bold, time-bound investment targets. Partnerships across agencies and stakeholder groups, and people's participation to achieve lasting behavior change. The World Bank stands ready to work with our partners and governments to achieve universal access to water and sanitation, as not just as a means to tackle the COVID crisis, but to build back better and ensure resilience against future pandemics and to invest in the future of our people. I wish you a productive event, and let's all work together to make a difference.
Thank you so much, Ms. Pangestu, for your statement and for your inspiring words. And it's now my great pleasure to hand over to SWA's high-level chair, the Honourable Kevin Rudd. The Honourable Kevin Rudd is the former Prime Minister of Australia, and he has been our high-level chair since 2015. He has been passionate about financing for the sector since he took up his role. I invite him to give us the global political context and make the social, political and economic case for investing in water, sanitation and hygiene, as well as the role of finance ministers. Kevin, over to you. Kevin, please unmute yourself. Super.
Thank you very much, Katerina. And to all my friends and ministerial colleagues from around the world. Many of you I've got to know personally as friends. It's good to see Tedros, our friend of the WHO, who I have known in his previous capacities in Ethiopia. It's good to see Mari Pangestu, who I've known previously in Jakarta, and other friends from the World Bank and from UNICEF. And from the African Development Bank. Greetings, one and all. Friends and colleagues, I don't intend to read you a speech. I just intend to talk to you as friends because as someone who has served in a government, both as a minister and as a prime minister, I understand a little bit about politics. Politics is a hard business, and you're all in politics. I understand that. It doesn't matter what country we're in. You're in Francophone Africa, you're in Anglophone Africa, you're in Lusophone Africa, whatever Africa you're in. Politics is politics, and it's tough. And so the argument I want to put to you today is pretty simple. And that is, given all the economic and public health problems which all of our countries face right now because of the global COVID crisis, how do we turn this crisis into a political opportunity for us all? And my argument to you is that even in the midst of this crisis, is that acting now on sanitation and water, and particularly on sanitation, is excellent politics for each of your governments, for each of your countries. Now you might say, well, that's easy for Kevin to say from the safe distance from Australia. I understand that. All our circumstances are different. But what I mean is, when you as sanitation ministers, or you as water ministers, or you as finance ministers, look at how you are going to come through this crisis, I think there are 2 or 3 things to bear in mind. Number one is, pretty simply, the lost economic and political opportunity that comes from not investing in sanitation and water. You know, every year, the bank has calculated that we lose globally about $260 billion in economic growth through the inadequate investment in sanitation services. And that is a huge amount of money. Put it into numerical context, it's 1.5% of GDP. And so when you look at your growth number performance, the mathematics is pretty clear. Non-performance in sanitation takes 1.5% off your growth, and therefore 1.5% off your employment growth. And therefore it affects the political prospects of all of our governments as well. So that's argument number one. Argument number two is pretty simple as well. It's that when we look at this COVID crisis, investing in water, sanitation and hygiene is not only, of course, necessary to control the virus, but it's now critical for rebuilding economies. Let me give you a couple of examples. Our friends from Benin, I hope they are with us in this gathering this evening. Great country, Benin. A project to create sustainable sanitation services for disadvantaged urban communities has led to the creation of 650 small businesses. That's good news. And each of those small businesses generates jobs. For our friends in Côte d'Ivoire, a $10 million rural school sanitation program generated nearly 1,000 jobs. So that's my second argument, is that by investing now in sanitation and water and hygiene, you're creating not just a good response to the COVID crisis, you're creating real jobs as you go along, as our friends and colleagues in Benin and Côte d'Ivoire have demonstrated. Now, the third argument is this. As I indicated before, you make these investments as part of a sustainable economic recovery. You're also adding to that 1.5% growth addition in the future to your economies overall. And the very final argument is this. Using this crisis and seeing it as an opportunity enables us all to reinvent how we finance sanitation projects in particular. Now, I know, those of you who are finance ministers, every time a sanitation minister walks in the door and says, I want to invest more in sanitation, the finance minister will usually run out the other door because it will cost a lot of money. But what I'm saying is that for you as sanitation ministers and finance ministers, there are now multiple different ways to finance sanitation projects, not just through traditional taxes and tariffs, but also through various cost recovery programs, through various blended finance programs, and through various social investment programs, and also through some larger scale private investments as well. In other words, there is an entire menu to choose from. As Katerina said before, friends and colleagues, I have, in my period with Sanitation and Water for All, had one priority: how to make the job easier for finance ministers and sanitation ministers. And that's why we've produced this book, which is a handbook, Water and Sanitation, How to Make Public Investment Work. It's full of practical examples of how you can use different financial models to finance sanitation projects and water projects around the world. And it's not just theoretical. Each one of the funding and financing options has real live examples from many of your states, not just in Africa, but across Asia and other parts of the world as well. So it's our attempt to be practical and to help on the way through. As I conclude my remarks tonight, I would once again return to you as friends and colleagues. You all know that sanitation is important. You also know the crisis we now face with COVID and the global economic recession. But if I want to leave you with one single thought, it's that there are creative ways through how to finance sanitation and water projects now to help the COVID response, to help the immediate creation of jobs and small businesses, and to give you an extra 1.5% in growth. And guess what? It's good politics as well. And the people will respond positively by putting up their hand to vote for you. And as a politician, I don't think that's a bad thing. I think it's a good thing. And so thank you for participating in this meeting. And I thank again our friends at SWA, led by Katerina, and at UNICEF for hosting this event and for bringing you all together to encourage one another. Back to you, Katerina.
Thank you so much, Kevin. Thank you for reminding all of us of the importance of investing in WASH for COVID, for jobs, for recovering the economy, and also, at last but not least, confirming that it's good politics. Also, thanks for showing the handbook that we know we are also proud of, and that was masterminded by you when we were at the Swachh Bharat convention in India some years ago. So thank you for your continued support and stimulus that you give us constantly. It's now my great pleasure to hand over the floor to Ms. Wambui Gichuri, who is the acting vice president of the African Development Bank and is well known to us for many years in the sector and in SWA. I would like to invite her to give her the regional context for this meeting, the state of water, sanitation and hygiene in Africa, the extent to which COVID has impacted its delivery in the region, and the role of finance in maximizing economic and health benefits offered by this sector. Wambui, over to you.
Thank you, Katerina. Excellencies, colleagues, friends, ladies and gentlemen, greetings to all of you. And it gives me great pleasure to join this SWA Africa Finance Ministers meeting to share some regional context remarks on behalf of the African Development Bank. It's obviously tough to give an overview of a region that is so diverse, and not just between countries, but within countries. But as has been mentioned by earlier speakers, the gaps in WASH in Africa are big and growing because of trends that I will mention. In Africa, about 400 million people lack access at least a basic drinking water service. About 400 million people at risk of suffering from waterborne and water-related diseases and cannot readily protect themselves from pandemics like COVID-19 because they lack water to wash their hands for this and for other hygienic purposes. The situation, as you've also heard, is worse for both sanitation and hygiene, in which about 800 million people do not have access to a basic sanitation facility, and over 700 million no access to at least basic hand washing facilities. There's clearly a lot to do, as we will hear some examples, because some work has been done, some progress has been made, and we look forward to learning from these examples. As I said, we clearly need to do more, notably, especially in sub-Saharan Africa, where JMP data shows that just 5 countries are on track to meet the SDGs. And in 39 countries, progress is slow. And in another 5 countries, the gains made in the past are in fact being lost, as investments in the sector are outpaced by the rapid increase in population. At current trends, the number of people without access to wash is increasing investments are simply not keeping up with growth in population. As you know, this averages high variations across and within countries. In some instances, service coverage, primarily in urban areas, is decreasing as utilities struggle to keep up with urban growth. These variations also impact other dimensions, say between low-income and high-income consumers, the rich and the poor, consumers in urban and rural areas. Also has a serious gender dimensions, as you know, and in this latter case, this has significant impacts on school attendance, dignity, and opportunity. I do not want this overview to be too quantitative or too pessimistic, as most of us here today understand the scale of the challenge that we face. We know that many of the underlying conditions, such as rapid urbanization, as I have mentioned, weak sector governance, climate change-induced rainfall variability. Our continent sees an increasing frequency of droughts and floods, limited incentives to attract the right skills in the right numbers, or as our topic today will articulate, insufficient investments. I want to underscore the fact that lack of access to water, sanitation, and hygiene has severe implications on our continent. You've had the numbers. Diseases, Africa carries a very heavy disease burden. Diseases such as pneumonia, cholera, typhoid, hepatitis A, skin diseases, and other wash-associated diseases and pandemics are prevalent due to inadequate access. Many of you will have seen this, and that in some cases, experiences we have gained in the past, like Ebola, we have learned how to react, as we did react in Africa, to move quickly and take measures, but we haven't institutionalized and developed services in a manner that is resilient. And because of that, the lack of the focus on emergency without thinking about long-term sector development is the reason we keep having to start again each time. We also know that COVID-19 has only further amplified these challenges and put WASH at the front line in the fight against the virus. Governments have introduced free water or payment holidays on water bills to ensure their people are not cut off from life-saving water provision and can therefore practice hand washing. Service providers are unable to collect their bills, whilst costs have increased, thus leading to further financial stresses on already overstretched resources. COVID-19 has highlighted the critical position that WASH takes at the nexus of public health and the economy. As you know, what started as a health pandemic in Africa and around the world has already had and will continue to have significant social and economic impacts that will take years to rebuild, that in fact have resulted in loss of a decade or more of growth. So as of beginning of November, the total number of cases, COVID-19 cases confirmed in Africa reached about 1.8 million. This we expect will continue to grow, and therefore these discussions we're having today about increasing WASH to not only continue to increase our protection against COVID-19 will be important in protecting us against other pandemics and other diseases as well. Providing access to safely managed water and sanitation, facilitating good hygiene practices provides people with protection from COVID-19, keeping them healthy and also able to contribute to the economy. We've had that sector development is about creating jobs. Sector development is about broadly contributing to the economy, but also supporting schooling of girls. It's going to support proper functioning of health centers, etc. So it's, water development goes way beyond that to also improve nutrition, which is a major issue in Africa, as you know. Investments in the sector not only provide employment opportunities for grown-ups, it's also an opportunity for the youth. As we hear, Africa is not creating nearly enough jobs. We're creating no more than 10 to 20% of the jobs that need to be created every year. and increasing investments will provide additional opportunities in a sector that the youth have not really seen as a big opportunity. We need to expand it, make it more attractive to attract the youth to come along. It also will set up decades-long stream of future health, environmental, economic, and social benefits. Despite the many challenges facing the sector, it is clear that access to adequate funding and finance is central to achieving SDG targets. We know that there is a huge financing gap for new infrastructure. We also know that there's a lot we can do to leverage more benefits from the finance that we've already put, to make sure that systems are running and serve their populations through the design lives of these investments. In sub-Saharan Africa, the annual investment required to meet SDGs has been estimated at $35 billion a year. In North Africa, the amount is estimated at $4 billion a year. And this is many times more than what is historically being invested, estimated at about $11 billion. Small sample as part of the WHO UN GLAS survey indicated global financing gaps of between 39% for urban water supply and 78% for rural water supply. Remember that Africa, even though Africa is fast urbanizing, still the majority of the population today lives in rural areas, and that's where the biggest, big gaps relative to urban taken more general. But in fact, the biggest gap in dollar terms was in urban sanitation. We all need to work collaboratively to address the finance needs for WASH in Africa. In the Finance Minister's Handbook, launched on 3rd of September 2020, and as mentioned by Kevin, SWA brought together a range of practical examples of how to address these gaps. This included actions to maximize value from existing funding, mobilize more funding, increase repairable domestic finance, and encourage innovation to secure new sources of finance. Our objective today is to build on the handbook and to share and discuss experiences from around the region on actions taken by sector and finance ministers to improve the levels of investment in the sector. At the same time, continuing the ongoing search for more efficient, effective, and credit-worthy providers. At the African Development Bank, we continue to prioritize the water sector to address the many issues that I have outlined. And over the past decade, the bank has invested over $6 billion in WASH services. And the bank has also mobilized an estimated $150 million in climate finance from global environment facilities and the Green Climate Fund to co-finance water sector projects. And these have led to an estimated 52 million people gaining access to improved WASH. And the bank, over the next 12 years, aims to provide an additional 150 million people with improved WASH services in Africa. We're also placing emphasis on private sector participation as an option and as a player to support and expand sustainable management and financing of services. I want to end by reiterating the critical role of the sector in preventing spread of COVID-19 and other pandemics, as well as in the recovery, rebuilding of our economies going forward. Thank you very much, and I wish you all a very fruitful discussion. Thanks.
Thank you so much, Wambui, for setting the regional context. And thank you to all our opening speakers. Now that the scene has been set, let us turn to the discussions, which is what we are all waiting for. We are very fortunate to have Dr. Canisius Kanangiri, who, as I said, is the Executive Secretary of AMCAO, moderating for us today. AMCAO is one of our founding partners, and we have always worked very closely and productively together. Dr. Kanangiri will take us through the country practices, Zimbabwe and Egypt, which each focus on different aspects of financing for the sector. He will then bring one Vice Prime Minister and other finance ministers who are in the room. He will bring them on board for a very fruitful discussion, I am sure. Canisius, over to you.
And we will have also some input from the Vice Prime Minister from Congo and from the Minister of Finance from Nigeria, and some other ministers of finance will also contribute to this. I will introduce the country practice separately, and then invite the relevant ministers to come in and provide some more insight to the experiences and the approach that they have taken to address issues of finance in their countries. After the ministers of finance have spoken, I will then invite questions and comment from other ministers or from the floor, and then others also will have a chance to put their question in the box, and those other questions and comments will be addressed in the next session, which will be moderated by my colleague and friend, Katarina. So for ministers, please, if you want to ask a question and make a comment, raise your hand from the platform on your computer, or put a message in the chat box. For others who are not ministers, please write your question or comment in the chat box, and it will be addressed, as I said, in the next session. Now, permit me to also repeat one thing that Katarina said at the beginning of this session. We have only 120 minutes for this meeting, and we want it to be a dialogue, a very lively discussion on financing the WASH sector. And since we have around 43 ministers in the room, we need really to be mindful of the time we have, so that our comment can be short, our questions and our answers short enough to allow people to share experiences, because this is what we really would like to value. So let me now go to the first country practice, Zimbabwe. For many years, Zimbabwe had followed a top-down, supply-driven, subsidy-based approach to expanding access to sanitation and hygiene facilities in rural areas. However, access was not increasing. There was a cholera outbreak in 2009-2010, and capital subsidies were drying up. A new model was needed. Realizing that this approach was not sustainable, the government decided to dramatically shift its policy to a non-subsidized, demand-led approach, which with the aim to eliminate open defecation, increase sanitation coverage, and inculcate good hygiene practices. The model was not completely without subsidy, but they were limited to just 15% of the cost of an upgradable, ventilated, improved pit latrine, and targeted at the most vulnerable families, those who are the poorest of the poor, and those are only estimated at 5% of the population. The approach built on a range of national and international experiences to come up with a Zimbabwe-specific solution. And the results were impressive. Under the new model, based on results, phase 1, supported by UNICEF, the estimated annual construction rates for a scaled-up national program would be 7 times higher at over 140,000 latrines per year, sufficient to meet the SDG for sanitation before 2030. This was achieved in the face of poor national economic conditions. In the phase 1, communities were able to mobilize around $12 million or a minimum of $50 per latrine. That is very impressive. And Honorable Mtuli Mchube, Minister of Finance, is with us today. I would really commend the effort that was done by his government and all the partners working with them. It is, as we know, a government obligation to ensure that everyone has access to water and sanitation services, with assumption that they must also finance that provision. This example shows that governments can take a more facilitating role and mobilize household finance, thus freeing up public funds for other uses, whilst also demonstrating a clear willingness to pay for such services at the household level. Why do you think this was such a success in Zimbabwe? And do you see other opportunities for governments to partner with households to expand access to water and sanitation services? That is the question that I would ask you, sir.
Yes, we can. Or we cannot?
Can hear you.
On the ground by financing, in a sort of simple, low-cost way, sources of water. These could be productive wells, for example, and then a government can then come in to monitor the quality of the water to certify that it's being done according to certain standards, and the standards are then also applied to make sure that it is safe drinking water. We think that moving on to then into water provision is one area we should pursue, and we're going to be pushing in this direction. We've really been astounded as to how partnering with the communities, allowing them to lead, allowing them to express their sense of choice, actually it works, and we're able to deliver more and be able to play our regulatory role as government or as effective partners. Thank you very much, Karangira.
Thank you so much, Honorable Minister. Indeed, there are key factors, and those that sharing the responsibility with household is one key thing, and working on demand, of course, it is one of the key things that we need to take as a lesson. Let me go to the case of Egypt. In Egypt, we have a mix of initiatives that aim to reform and finance the sector in new and innovative ways, whilst generating employment and increasing gender equality. The Integrated Rural Sanitation in Upper Egypt, LUXO program, incorporates a result-based financing instrument where disbursements are directly linked to the program's achieved result. The construction and the service provision will provide local employment opportunities, particularly for young people, as well as specifically train women to enhance their integration to the labor market. The Sustainable Rural Sanitation Services program for Result Loan aims to strengthen institutions and policies to improve services and expand household connections to sanitation systems in 3 rural areas using result-based financing. This introduces alternative financing mechanisms for utilities, encouraging a greater focus on result. In other initiatives, the government has developed a large-scale greenfield urban wastewater treatment plant in Cairo using a design, build, finance, operate, transfer, raising up to $140 million of private finance in the process. This is also an impressive way of approaching it, which comes to enrich and complement what we have been sharing on the case of Zimbabwe. I think to get more clarification on this, I will call upon Honorable Minister Dr. Mohamed Ahmed Mat, Minister of Finance of the Arab Republic of Egypt, to come in and share with us more on the Luxor case. Honorable Minister, the floor is yours.
Thank you very much, Chairperson, and let me first of all welcome all our attendees and thank Sanitation and Water for All team for convening this important virtual meeting in this critical time in which all of the world is fighting against COVID-19, especially since the availability and access to water and sanitation and hygiene is fundamental to fight the virus and preserving the health and well-being of millions of people. COVID-19 will not be defeated without access to safe water for people, especially those who are vulnerable. I want to thank you for choosing those 3 success stories as a model in your introduction, since they could provide an overview of the different ways of financing that we use in Egypt to continue our effort to achieve the 6th goal of the Sustainable Development Goals. Drinking water supply and sanitation sector in Egypt is characterized by both achievement and challenges. Despite the rapid population growth in Egypt, which is one of the highest in the world, the current coverage of safely managed drinking water sources in Egypt is about 98.7%, which is 100% for urban areas and 97% for rural areas. The current safely managed sanitation is about 65%, 96% for the urban areas and 37.5% for rural areas. It is about to be 50%. It was about 50% in 2014, and we are expecting to increase it to 75% by next year. Increasing access to safe drinking water, adequate sanitation services, and improving water resources management are central to the basic right of every human being. Egypt has set an ambitious water agenda in that regard. In addition, Egypt has also taken several measures to meet the Sustainable Development Goals targets for drinking water and sanitation. I would like to shed some light on the effort exerted by the government of Egypt. For the period between June 2014 till July 2020, the government has made the water and sanitation sector more equitable and sustainable. Total investment in the water and sanitation sector during this period is about $11 billion, which has contributed to the completion of 1,131 projects, which served people in cities and rural areas by increasing access to drinking water and sanitation through rehabilitation projects, creating new household connections, and increasing the capacity of existing projects across all governorates. The government aims to achieve 4 main objectives: reducing water physical and commercial losses, improving water pressures, rehabilitation of networks, in addition to improving the efficiency of service provided to citizens. It is important to mention that all the treatment plants are currently being constructed on a world-class standard with central laboratories to ensure that quality of the services are provided. To respond to your question, I will focus on the Integrated Rural Sanitation in Upper Egypt Luxor project, which is part of the National Rural Sanitation Program. The Luxor project in the final signing phase to be with funding support from the African Development Bank and Rural Water Supply and Sanitation Initiative Trust Fund, with a total amount of approximately $127 million for the development of wastewater networks and wastewater treatment plants for rural areas in Luxor Governorate in Upper Egypt. The expected completion date is end of 2026. The project is expected to increase sewerage coverage in the region from 6% to 55%, thereby improving the quality of life of citizens, especially women and children who are most affected by poor sanitation. Furthermore, the project includes capacity building, part to improve operational system and practice of Luxor water sanitation companies. The capacity building plan benefiting at least 30% of women in the Luxor governorate. In addition, it will create a considerable number of direct and indirect jobs. I would like to stress the commitment of the Egyptian government to invest more and more in the water and water sanitation to encourage private investment in such a project, including using public-private partnership financing mechanism, as mentioned in the introduction. Finally, I would like also to mention that the government of Egypt, effort to develop a sovereign green financing framework, which will enable Egypt to finance existing and future eligible green projects. The government of Egypt believes that the entry of the Egyptian sovereign in the green bond market will establish a market precedent and encourage the private sector to start using sustainable finance instruments. It has also become important to take advantage of the proceeds of sovereign green bonds in financing multiple projects in different sectors according to their priorities. On 28th of September, Egypt issued $750 million in green bonds, and this was the first region's first sovereign offering of climate-friendly securities. The issuance was more than 5 times oversubscribed, pointing to growing appetites for climate-friendly securities worldwide. Egypt has a portfolio of eligible green projects worth $1.9 billion, 16% of which are in renewable energy, 19% for clean transportation, 26% for sustainable water and wastewater management, and 39% for pollution reduction and control. At the end, I would like to stress on Egypt's commitment to become a leader in green development, to be an example for the rest of Africa and the Middle East. And I thank you very much for listening.
Thank you very much, Your Excellency. This is very informative, very enriching, and I hope we will get some comments or any question for more clarification. If we have more time, we will be very glad to give you time to clarify more. Maintenant, j'ai l'honneur de faire appel à
I have the honor to call on His Excellency.
Excusez-moi, il y a...
Excuse me, I had an echo. I now have the honor of calling on His Excellency, Her Excellency Madame Elise Mwemwe Tamukumwe, Vice Premier, Prime Minister and Minister of the Plan of the Democratic Republic of the Congo, to share with us the experience of the Republic of Congo on finance of the sector of water, sanitation and hygiene. Excellency, Madam Minister, Madam Prime Minister, Deputy Prime Minister, you have the floor. Thank you. I would like to talk about the situation of the Democratic Republic of Congo and the sector of water, hygiene and sanitation. The sector of sanitation, water and hygiene in Congo is driven by the Ministry of Plan and the National Committee on SWA and for coordination in the sector. The Congolese government has just put in place a national plan for sanitation and to have access to water and for the percentages to improve hygiene, sanitation and hygiene for all the Congolese, and to indicate to prevent defecation in the open air. And the sector of water and sanitation and water that will contribute to the better health of the population of the Congolese people, investments for the good operation of the country. It offers economic and social development opportunities to stimulate the economy and for all the inhabitants. And our investment bank in the sector of SWA during the COVID-19 pandemic will, for the private sector, for the economic enterprises in our country, and to widen the scope that which are due to the diseases that affect households. And then with the other advantages from investment in this sector, it's our idea to have economic advantage from this investment, social advantages particular, so the diseases linked to sanitation and water, the creation of to reduce unemployment and to have so that young girls don't have to collect water, and to improve conditions for them. And so given that the sector, the informal sector is more than 70% in economic activities in the DRC, this is an opportunity to sustain efforts to improve the sector. So the Congolese state asks all the actors in the informal sector to make an effort and to apply the law, which is on the law on water, and for the private sector to invest in this sector to transform the economic impact on sanitation and to improve economic gains. So provision of the waters, this will not only contribute to restricting the COVID-19 pandemic, but also other diseases like cholera, malaria, diarrhea, and malnutrition. And this will contribute to reducing the unemployment level, to create jobs and improve income. And to invest in this sector, we hope to impact on the social and economic areas. We will have specific actions that we will undertake to organize, to advocate for an improvement in this sector, so that partnerships can be created to improve and to motivate the institutional function. Thank you. Excuse me, if you could get no closer to the microphone. I was saying to have somebody in the water sector it would impact on the social and economic conditions of the population. The sectoral minister will undertake specific actions to organize advocacy for an increase to support to the sector so that partnerships with the different actors can be stepped up and to improve the sector. So these are weaknesses that we have identified in the Congo, and we want to promote measures to incentivize the partnerships and to increase the budgetary lines in the sector, and that they will effectively take place. So to improve the budgetary allocation for water and sanitation, and to also talk about 0.6% to increase the amount, and for climate control actions that we can also, that will be an additional source for sustainable management of resources, that with the threat from climate change, which is a threat to the environment, and we feel that we know that this is a pressure on our resources, and we know. Thank you very much, Excellency, for your expose, which is very interesting. I will now continue to see that there's a lot of experience that you have.
Et après cela, nous
and so after this, we can now.
Yeah. I will now, I will get some more experience from other African member states so that we can be able to ask questions just after all those presentations. I will take now the opportunity to invite Her Excellency Zainab Ahmed, Minister of Finance, Nigeria, to also share briefly the experiences of Nigeria on wash sector. Your Excellency, you have the floor.
Good afternoon. Thank you very much, Dr. Kaninga. And thank you for the opportunity for me to intervene at this time. Access to water, to clean water and improved facilities in Nigeria is still a daily challenge for many of our people. This problem is particularly acute in the northern part of Nigeria. This problem contributes to the very high prevalence of waterborne diseases. It threatens lives, it threatens livelihoods, especially of smallholder farmers. And also, it increases the level of the level of enrollment in our schools, especially amongst girls. The federal government of Nigeria, in partnership with state, local government, and development partners, is vigorously increasing access to safe water, to improved sanitation, and to improved hygiene. In November 2018, the president declared a state of emergency in our country in the wash sector. But this declaration of state of emergency was quickly followed by a launch of a national action plan that indicated the strong political leadership towards moving to universal access. This national action plan gave us an opportunity to strengthen political leadership and also create and perfect existing partnerships, and also to help mobilize the community to participate so that behavior can change. The Ministry of Finance, Budget and National Planning is a major stakeholder in this endeavor, and we are working with the Ministry of Water Resources to continuously increase our investment in the water and sanitation sector, recognizing the fact that investing in WASH is actually investing in human capital development and is direct investment into the economy. We also saw an opportunity that was provided fortuitously by COVID-19 to improve on water and sanitation, as well as improving in health facilities and education facilities in our country. We saw opportunities being between mobile hand wash facilities in producing hand sanitizers that is helping us to increase the hygiene that is necessary to curtail the expansion of COVID-19 in our country. And I must say that we have been lucky that the COVID-19 is. We also saw an opportunity on the finance. We have had in the past 2-3 years issued green bonds, but we are also vigorously trying to access some other sources of green financing that have been available that is ideal for developing of our water and sanitation sector. We also saw an opportunity through this pandemic that we're going through to educate not just the people, but the executive and the parliament to understand the wisdom of investing more and more in the wash sector. Because investing in water and in sanitation is actually investing in health, and it's investing in education, and more, and also very importantly, is also investing in the economy. I want to thank the organizers for inviting us, and also for the opportunity I've had to listen to some of the things that my colleagues are doing, and to commit to continue to work with this forum towards improving investment in water and sanitation. Thank you very much, Mr. Moderator.
Thank you very much, Your Excellency. And indeed, I think the case of Nigeria is very informative. And another thing, when you were concluding, to involve other decision-making, policy-makers, organs to come in, like members of parliament and others, I think it builds more momentum towards better financing and more actions on the ground to change really the situation. Allow me now to call upon Honorable Minister Claver Gatete from Rwanda to also share some experience from Rwanda on WASH. Honorable Minister, the floor is yours. Honorable Claver Gatete.
Canisius, I'm sorry to step in. This is Katarina. I think the Honorable Minister had to step out, so he's not in the room right now.
Okay. Thank you. Let me call upon Mr. Barsa. John Barsa from USAID to come and give us some insight on all these very nice and very useful inputs we received from these different countries. Mr. John Barsa, the floor is yours.
Thank you so very much. Hello, everyone. It's a pleasure to join you all today to discuss such a pressing and timely issue. As many of you know, COVID-19 is ravaging international access to water, sanitation, and hygiene. Based on phone surveys supported by USAID in 5 African countries, as many as 300 million people are already facing challenges in accessing drinking water. As incomes drop, prices rise, and water is available for fewer hours, many households have less money to pay for water. And in many countries, service providers are at risk of outright insolvency because of pauses on customer fees, higher household demand, and lower industrial use of water. Women and girls often experience the brunt of water shortages as well. They often bear responsibility for collecting water, and they're especially at risk of COVID-19 transmission when using public water points and latrines. In addition, gender-based violence, which has already increased during the pandemic, continues to be a risk during water collection and at public latrines. Every one of us here today has a responsibility to ensure that water systems will not be as vulnerable when the next crisis hits. If we do not make these investments in water infrastructure now, Africans across the continent will pay much more in the long term. In order to achieve universal access to basic water and sanitation services, the World Bank estimates that we need an additional $114 billion in capital expenditures each year through 2030. Even then, this estimated resource gap does not include the cost of operations, maintenance, governance, and more. The real need is even higher. A lack of sufficient and sustainable financing has led to system breakdowns and a loss of trust in government services. But the private sector is well suited to strengthen these systems through technical support, maintenance, financial management, and commercial investment. Increasing private sector engagement is critical to closing the WASH sector's financial gaps. At the same time, national governments must provide leadership in developing sector financing strategies. Governments must dedicate sufficient public funds to water and sanitation and ensure that funds from all public and private sources are used efficiently and transparently. Currently, many service providers are not attractive enough to commercial investors. These providers need help to improve their performance and policies in order to secure enough financing for this sector and to increase revenue. And without enough financing, resilience will be impossible. That's why USAID is committed to supporting ministers of finance and your multi-stakeholder partners to develop financing strategies that will support sustainable water and sanitation systems through a combination of both public and private finance. Many governments participating today have declared water an essential service during the COVID-19 pandemic. Governments are providing free water to ensure that communities continue to have access to water that is safe to drink and use for hand washing. But this declaration has strained service providers, and it is critical that we mobilize public resources to subsidize costs in the short term. However, short-term subsidies will not be enough when it comes to preparing for the next pandemic, financial crisis, or natural disaster. We must strengthen the entire system to advance self-reliance and resilience to future shocks. The WASH sector requires significant and continuous public funding, and private sector finance must complement those public investments. But we recognize that private sector investment may remain low until service providers adopt stronger business models and practices. To face this challenge head-on, I'm pleased to announce that USAID is extending our flagship WASH financing activity till September 2022. Our country missions will provide up to $10 million more to close financing gaps and mobilize further resources to ensure that all citizens can access adequate water, sanitation, and hygiene services. We will ensure that no momentum is lost as we work to prevent utilities from collapsing under the strain of COVID-19, while also improving their creditworthiness for the long term. It's an honor to have USAID's work featured in SWA's Finance Minister's Handbook, as well as today's meeting. We're encouraged by today's case study from Kenya and are pleased to work with the governments of Kenya and the Netherlands on these important issues. Part of our shared path forward must be to address challenges of governance and institutional capacity, which create barriers to widespread commercial finance in the WASH sector. Broader financing strategies at the country level are essential for a holistic approach to the sector's sustainability. In closing, I'd like to pose two questions to the honorable ministers with us today. First, what challenges do you face in using finance guarantees to break into new markets or expand services? Second, how is this impacted by challenges created by the COVID-19 pandemic? Again, thank you for the opportunity to speak with you all today. We really look forward to continuing our collaboration to achieve universal access to clean water and adequate sanitation. Again, thank you so very much.
Thank you very much, Mr. John Bassa, for this very informative presentation, and which ends with two very important questions. I believe that honorable ministers and other participants may come to that for some clarification or what they do in those two cases that you have presented. I have received here the request from two ministers to say a few words on what we have been talking about for the last minute, almost an hour. I will call upon the Minister of Finance from Liberia, Honorable Samuel Tue, to say a few words, and I will request that Your Excellency, you have the floor.
Thank you, Your Excellency, and thanks to honorable ministers and heads of WASH agencies across Africa on the call. I think it's quite an important opportunity in the current post-COVID context, or maybe not even post-COVID context, to really think about WASH. As finance minister responsible for budget and financing, it's from my perspective, I can clearly say that I don't have a clear appreciation of the WASH sector. And I wanted to share some experiences with other ministers and with other agencies in the realm so that we can solve this problem. Number one, we didn't meet any of the WASH MTGs. Let's say that. The Millennium Development Goals, several countries didn't meet those. We're falling far behind the WASH-related SDGs as well. So the norm is that we are expected not to meet these things, even though we're gathering here at this forum and other conferences, we talk about WASH and all of that. So we have to change that game in a post-COVID sense. And what does changing that game means? There will have to be new principles. For example, the share of funding from the African Development Bank, the World Bank, the European Union, all of our multilateral partners, going to waterborne, the curative waterborne diseases, all right, the share of that resource is huge relative to the share of resources we're spending on WASH. So the money countries are spending, the World Bank is spending on dealing with diarrhea and waterborne diseases is huge. But because we're looking at the curative aspect, what if we were thinking on the preventive typology so that shifting the burden of resources from curing waterborne diseases to preventing them means that we're looking in our resource allocation for those projects, we should be shifting our resources more to WASH activities, which will then prevent the existence of these kinds of diseases. We need to think about that principle because the share of resources continue to grow, even though we still are faced with the burden of the diseases because WASH systems are broken across Africa. My country is included. All right, so we need to think about that. The other point is that agencies across governments, including my own WASH Commission, I'm looking at my director now, will have to develop a better strategy for engaging national authority. Let me tell you what I mean by that. As Minister of Finance, I go to the World Bank, I go to IMF meetings. I'm quite comfortable about talking about infant mortality, maternal mortality, child stunting. These are the indicators we're talking about. I'm not really talking about WASH-related indicators. And why is that the case? Is it because, we're not communicating WASH programs effectively, nationally and internationally? Open defecation goals are quite significant for health purposes, access to water in the rural areas. Ministers are not really talking about WASH-related indicators. That's the point here. So finance ministers are not talking about those. We are bragging about our gains in maternal mortality. We want to show gains in those areas. We need to change that. So that means a strategy for engaging national authority so that we increase the share of the budget going to WASH should be there. So we have to communicate with ministers in a way that shows that the WASH-related resources are delivering impacts in rural areas, and we're able to quantify those impacts and demonstrate them nationally so that people see the relationship. That has to change in the post-COVID context as a means of raising resources. We need to talk more private sector. Okay, talk more private sector. In Liberia here, we're now working with a PPP model and our water company to improve commercial viability, to improve revenue generation, so that we can generate resources to solve rural problems. We've been able to develop a WASH commission, which I think we've not put on budget yet, but it seems that we are quite, in terms of our sector planning, we're quite advanced in Liberia. Yeah, we have a WASH commission, we have a sector plan, funding that plan and making sure all of the programs are quite lined up, I think, remains a challenge. And the president is committed to doing that. So, in terms of COVID, Liberia, we provided free water for, for citizens to the tune of around 1.5 million already. And we are taking a deeper look. So I'm raising these questions because now as Minister of Finance, I want to be looking through a WASH lens in a way that I wasn't looking through in the last 2 years since I became minister. To do that, the WASH Commission or the WASH sector, and I'm not just talking like Bureau of Sierra Leone, everybody, have to find a way to show that we can make progress in the sector because we're tackling big issues, we're tackling macroeconomic issues. We're trying to solve the infant mortality because the World Bank president, the former president, Jim King, used to talk about these big indicators. The current president, they're talking about under 5 mortality, child stunting. They're not talking about, the number of children who are openly defecating. They're not communicating these indicators. So WASH indicators tend to go below the radar. And as they go below the radar, we overlook the funding. I just wanted to share those perspectives with colleagues around the table. Thank you.
Thank you very much, Honorable Minister. I think we technocrats in this area will really try to provide those information and also bring them to the table of the finance ministers. And I'm very glad of what you have said. We need to link up and provide you with the tools that are needed. May I now call upon the Honorable Minister of Eritrea to also share 2 minutes because the time is not on our side. Eritrea.
Thank you, Mr. Moderator. Fellow ministers, representatives, diplomats, I am really honored to represent my country, Eritrea, in this SWA high-level ministerial meeting, virtual meeting, and I congratulate the organizers of this event, which will be a medium for sharing experience on how the participating countries have been implementing the WASH program and the way forward. To reiterate the very obvious and commonly narrated adage, water is life. That is, water is a fundamental resource for sustenance of life. Due to this defining role that it plays in securing socioeconomic development and overall human well-being, access to adequate and safe water, sanitation, and hygiene services is basically a human rights issue. With this understanding, Eritrea is working with great commitment to ensure this right for its citizens and to realize the SDGs by 2030. The progress that Eritrea made in this regard with global partners' participation is appreciable when compared to the awful conditions that prevailed before the independence. Of the total population, above 80% now have access to acceptably safe drinking water, and over 32% have access to toilets. Recently, 54% of our villages have access to tails, and recently 54% of the villages have declared themselves to be open defecation free. 50% of our schools have access to safe drinking water, and 67% have latrines, while 50% of the health facilities have access to improved water resources. The sharp reduction of waterborne diseases and the relief of thousands of people, mainly women and children, from the hard task of fetching water every day is worth noting. Since the outbreak of COVID-19 pandemic, the sector, especially hygiene, water, washing hands, along with social distancing, lockdown, and public health awareness campaign, has become top national priority in combating the spread of the pandemic. Despite these achievements, however, we have still many gaps and challenges to address, including water shortage, which is aggravated due to climate change, unmet water supply and sanitation services, as well as the need to upgrade the standard of existing water supply and sanitation and hygiene facilities, as well as improving the management of solid and liquid waste in the country. And the investment towards it is very huge. The government is implementing the One Wash strategy and investment plan and the National Resource Roadmap to end up open defecation by 2022, and it has also embarked on conducting wash inventory and costed plans. Since the investment in this regard will be huge, cooperation of development partners is highly appreciated, and I confirm that Eritrea will exert every effort to meet the goals of WASH, and I thank you for your attention.
Thank you very much, Honorable Minister. Indeed, we need to really commit to push forward all these agendas so that, as Honorable Minister from Liberia said, we don't need to have the same record that what we had after the MDGs. Honorable Ministers, distinguished participants, I noticed that the time is not really on our side. And because of that, the few questions that I have received may be addressed to other levels at country level, or some will be selected for the next session. I want to thank you, Honorable Ministers, for your keen participation and your engagement in this session, and also the sharing of a very valuable information with the participants here. We listened with attention and we take the message home in our heart, in our brain. I want now to call upon my colleague and friend Katarina to moderate the second session, which will involve other stakeholders. And I wish to thank you very much for this productive session and for a whole productive FMM. Thank you very much.
Thank you so much.
Thank you very much.
Thank you, Canisius. Distinguished ministers, if you want to stay with us in the meeting, this would be highly appreciated, and there will be further opportunities for engagement and also for exchange of questions and answers. Let me now move to a small video that we prepared. We asked our partners to explain how their respective organizations are contributing to reaching SDG 6 and making sure that there is finance available for the achievement of this important sustainable development goal. So we will now play the video.
As you know, AMCAL is spearheading the development of the African Sanitation Policy Guideline. And this is one of the most important documents that we need to guide Africa in shaping up the enabling environment for the continent to really embrace the programs that we have in the sanitation and water and hygiene, so that in 2030 we can be proud of our journey towards the targets of the SDGs.
Ensuring access to safe water, sanitation and hygiene will be crucial to propel the worldwide socio-economic recovery. The visionary leadership of ministers of finance in this area is now needed to help countries build forward better from the pandemic, to realize societies that are more equitable, more resilient and more sustainable, and to get the global goals firmly back on track. On the ground, in 170 countries, UNDP, the United Nations Development Programme, will continue to work closely with our partners to pool vital resources and know-how to finally end the exclusion of the poorest and most vulnerable from the most basic services.
UNICEF has been working around the world in over 125 countries to help children and their families access safe water, sanitation, and hygiene they need to survive and thrive. And through this, we've seen how smart investments in WASH can lead to real impacts in communities.
Hi, I'm Kate Harawa,
from WestNet, a CSO watch group in Malawi. We contribute to the sector by working with government and other constituencies in analyzing budget allocations. This year, we wrote a convincing financing paper that makes the case for financing SDG 6. And this year, the budget has been increased from 26 billion Malawi kwacha in 2019 to 90 billion Malawi kwacha in 2021.
The UN Water family applauds your work and looks forward to joining forces through the SDG 6 Global Acceleration Framework. Thank you and good luck with your deliberation.
At the World Bank, we are committed, even now more than ever, to raising the critical message of linking financing to the achievement of the SDG 6 goals, whether it be public finance or private finance. The COVID-19 pandemic highlighted to the world the critical gaps in access to wash services, and especially in hotspots, healthcare facilities, informal settlements, and fragile and conflict-affected states. It has also stressed existing services and pointed out the financial vulnerability faced by many utilities across the world.
The SWA's private sector partners stand for partnership and mutual accountability. Partnerships between private sector and governments, civil society, and research and learning institutions. Partnerships that are built on shared objectives and firm commitments. But, most importantly, we believe in action. The SWA's private sector partners are businesses that are multinational and local, big and small, from all over the world. We're here to help you and bring you solutions. We want to help you accelerate private sector capacity and skills in your country. We look forward to working with you.
In light of COVID-19, increased investments in water sanitation are urgently needed. We at the Stockholm International Water Institute and the Research and Learning constituency support this by sharing innovative models and approaches, fostering peer-to-peer learning, and developing capacities for improved water resilience. This will make us better prepared for the challenges ahead.
Distinguished participants, while we were watching this video, and I thank all our partners for having shared their own videos with us, the discussion is continuing in the chat, and I was just informed that Mr. Tim Wainwright, the Chief Executive of WaterAid, has offered to support government ministries to develop costed national plans to deliver on WASH. Thank you so much, Tim. I was also told that Mr. Kofi Agosu is also in the room representing the ILO Director General. He's here with us today. And please continue to ask for the floor and to make comments. We will do our best to get back to you. It's now my great pleasure to invite Dr. Yetunde Omede of Zenith Water Projects in Nigeria to ask a question. She is representing the private sector. Please go ahead.
Greetings, honorable ministers and excellencies, all protocols observed. My name is Dr. Yetunde Omede, and I'm a consultant to Zenith Water Projects representing SWA private sector constituency. One of the major global issues facing us is ensuring citizens have access to safe drinking water, sanitation, and hygiene, even more so as we grapple with a global pandemic. In order to address such issue and create sustainable strides, governments and representatives of local communities should increase interest and involvement in multinational corporations to create better infrastructure in African countries. The private sector is willing to partner with African governments to provide innovative, resourceful, and sustainable ways to ensure citizens in your respective countries have access to safe drinking water, sanitation, and hygiene, which will also have a strong impact on public health concerns. With that being said, my question is, has your government looked at other alternative resources to promote the private partnerships, such as tax credit schemes, blue bonds, and tariff reforms? Access to clean drinking water will take more than the government sector to provide. The corporate sector is willing to offer innovative ways to ensure not only management of waterway systems, but creating water systems in rural areas. In what ways can you envision such partnership? Thank you.
Thank you so much for your question, and it's now my great pleasure to hand over the floor to Aaron Salzberg, who is representing the Research and Learning constituency inside SWA, and who is now heading the Water Institute at UNC, as we can see in his background. Aaron, over to you.
Good morning and good afternoon, everyone. Thank you, Katerina, for the introduction. In addition to all that, I'm also a former rocket scientist, and I used to put things into space. And so I can say with certainty that the challenge of providing universal access to safe drinking water and sanitation services is not rocket science. It's actually harder. Not only is it a technical challenge, but it's a social, cultural, and in many cases a political challenge, but above all, it's a financial challenge. The Research and Learning constituency of the SWA can help. As you've already noted, science and research can play an important role in informing your choices on how to best extend services and respond to COVID-19. It can give you the data you need to design taxes, tariffs, and transfers, and as Minister Otoya said, measure impact. It can also support the regulatory and policy reforms that can improve services, protect against water insecurity, and address long-term inequalities. Ideally, this is done through your own research and learning institutions. At the end of the day, you need to be able to turn to your own experts rather than sending water samples outside of your country for testing or relying on outside cost-benefit analyses to decide which technology or which policy approach is best for you. So investing in your own research and learning institutions and including the RNL community into your decision-making processes is critical. They are your long-term partners and they are ready to help you. And that's what we need to hear from you today. What are the questions that you want answered by the RNL community? What is the data and the evidence that you need? And what can the research and learning community do to support your efforts to address WASH challenges? Thank you, Katerina.
Thank you so much. Thank you so much, Aaron, and thank you for the effort, for the offer. And this follows up on the discussion that we were having at the Water and Health conference 1 week ago, where we were discussing precisely how research can support policy making and us improving in water sanitation and hygiene. So the offer is there. Thank you so much. Let me now call on the civil society constituency, who is represented here today by Ms. Sareen Malik, who is also the Vice Chair of SWA's Steering Committee. Sareen, over to you.
Thank you very much, Katerina. Excellencies, honorable ministers, colleagues. Yes, we have spoken at length today that increased financing for water and sanitation is critical to respond to the COVID-19 pandemic. And as these services, especially hygiene, is the first preventative measure to the pandemic, but also to rebuild economies. To add to what Honorable Kevin Rudd mentioned earlier on, the FMM handbook demonstrated that countries that did invest in WASH also saw a 3.7 increase on their GDP. Many governments were making considerable debt repayments before COVID-19. Water and sanitation are already very low priority in national budgets. And now with these resources now being limited further and the pending humanitarian disasters resulting from collapsing economies, we call on you to protect water, sanitation and hygiene budgets in order to protect our communities, our people, our countries and the region beyond. We also call on the international finance institutions and development banks to work closely with our governments to reschedule and cancel debt in response to COVID-19. The most marginalized should be a priority. They are not, as they are the first victims of the crisis, but also the first actors in its recovery. Targeting the poor provides the highest marginal benefits, as we have said, ensures political stability, and more importantly, allows for governments to fulfill their responsibility and their promises to their citizens. We know that an average of 56% of subsidies reach the wealthiest quintile of a country's population, while only 6% reach the poorest quintile. Most subsidies benefit existing customers and are not used to extend services to those that don't have them. Our question, how can you ensure that subsidies allow for equality and are targeted to those further left behind, especially in a time of crisis such as COVID. Civil society wishes to work with you and your governments to help identify, target, and include those left behind, and ask for your support in allowing effective participation of citizens in defining and targeting budget allocations. We are here to support you to make the invisible visible. Thank you.
Thank you so much. Thank you so much, Serene. Is there? So we are receiving some questions from the floor, and I wonder. And there were now some questions asked by the representatives of the three constituencies, and I'm opening up the floor for any of the distinguished ministers who wishes to either answer one of the questions that were asked, or who wishes to ask another question or comment on a previous intervention. Please just unmute yourself. Okay. As I was saying, we've received several questions. For example, regarding the question of knowing how governments envisage an inclusive approach and how can other stakeholders better support so that we leave nobody behind. Another question is, are finance ministers willing to consider issuing dedicated long tenor SDG water infrastructure treasury bonds on the local capital market to attract private finance to the wash sector, for example? Or the water sector has faced challenges related to show adequate progress, and there is wastage due to corruption and systems failure. As a finance minister, do you think the sector is doing enough to improve credit worthiness and thus access more finance? So these are some of the questions that can be addressed now, or that will guide us inside the partnership in the work that we are now starting to do or continuing to do or strengthening in the area of finance for water, sanitation and hygiene. So I'm sorry that I don't manage to see everyone, as I have 108 participants in front of me. If there is nobody else wishing to take the floor, and I know that we are running out of time, I would bring this discussion to a close. I would thank you all for your time, and I will hand over now the floor to the Honorable Cecilia Dakar, who is the Vice President of AMCAO and also the Minister of Sanitation and Water Resources of Ghana. She has been an unconditional and enthusiastic supporter of the work that is being done not only in Kenya but worldwide on water, sanitation and hygiene. Her energy and enthusiasm is contagious and inspires us all. Dear Honorable Minister, you have the floor.
Thank you, Katarina, for all the warm words. I am very happy to join you today for this Zoom meeting. Right Honorable Chair, colleague ministers, development partners, and of course, the indefatigable Katarina, distinguished ladies and gentlemen. I am very pleased to join you at this important event to give the concluding remarks for today's meeting on how we all can share ideas towards effective, predictable, and sustainable financing for the water, sanitation, and hygiene sector, which will go a long way to eliminate inequalities in accessing wash services. Thank you, moderator, for your excellent moderation of the discussions today. And thank you to the honorable ministers from Liberia, Eritrea, Nigeria, Congo, Zimbabwe, and Egypt for your insightful and engaging contributions, as well as those who zoomed in to give constituency messages. It is estimated that over 2 billion people in the world have unequal access to water, while a massive 4 billion people are without access to basic sanitation facilities. The onset of the COVID-19 pandemic has worsened the plight of the poor and vulnerable and have seriously eroded the gains, if any, of attaining universal access to water and sanitation, and leaving no one behind by the year 2030. In these difficult times, we need to play a key role, both by responding to COVID in the short term and building of a more equitable and sustainable future in the long term. This places an onerous task on us to deliver good quality, universal, efficient, and affordable services. We must also strengthen capacity, ensure good governance, and provide the needed enabling environment that will facilitate access to new and larger amounts of investment in the wash sector. These are indeed challenging times for all of us, individually and as a sector. As we heard today, water, sanitation, and hygiene is the nexus between public health and the economy. Providing access to safely managed water supply and sanitation and facilitating good hygiene practices provides protection for our people from COVID-19, whilst keeping them healthy and able to contribute to and sustain the economy. At the same time, investments to build new systems do not only provide employment opportunities, especially for the young, but it also sets up a decade-long stream of future health, economic, and social benefits. There is a considerable range of economic benefits that follow from investment in wash infrastructure provision. For low-income countries, improved wash and economic growth go hand in hand and contribute to unlocking communities from poverty and support the discovery of economic potential. I hope that by bringing finance ministers together for this meeting and sharing experiences, there will be a greater appreciation and prioritization of the sector when the time comes for tough budget negotiations and decisions. In Ghana, I want to just state here, brief, what we've done during this COVID time. The president directed that all Ghanaians should enjoy free water supply till the end of the year, which is highly commendable, so that people will have access to personal hygienic practices and also good potable water in order to prevent diseases that are associated with lack of water in the system. This means the government has put its money where its mouth is. We are spending the equivalent of 160 million as a result of this free water supply to Ghanaians, and we are trying not to leave anyone behind. Also, investments for 9 months, yes. The free water supply is for 9 months till the end of it. We started in March till the end of the month, and we are still in it, enjoying free water from His Excellency, the President's directive. The government has also invested to the tune of $1.7 billion on water projects, which sorts have been cut for them to start. By the time we finish with these projects, we'll have 5.5 million people enjoying potable water supply. In sanitation, we've also invested, especially in these COVID times, the equivalent of about $50 million to make sure the environment is kept clean and the toilets have been provided. We have provided over 122,000 household toilets in the process, and we are still counting. The estimated cost of meeting the United Nations Sustainable Development Goals, SDGs, for drinking water and sanitation services is $1.7 trillion, 3 times more than has been invested in the sector to date. How do we ensure that with 10 years implementation period left for the attainment of the 2030 agenda, we can fully attain the targets under SDG 6? The time has come for us as governments, sector ministers, colleague ministers of finance, and donor partners to walk the talk and come up with innovative ways of funding the wash sector. Investing in the water sector is not a burden, but a huge opportunity and a catalyst that can adequately propel the attainment of other SDGs. It is sector ministers who need to build support and consensus around the gains that come from universal access. It is civil society who need to convince politicians of the benefits to their constituents of good quality services. It is finance ministers who can challenge all sectors to put evidence-based arguments for their claims on the public purse. Distinguished colleagues, it is very worrying that aid commitments to the water and sanitation sector in sub-Saharan Africa declined sharply from $3.8 billion to $1.7 billion in 2017, according to the GLASS report of 2019. We need more investment, and today we've seen and discussed opportunities to mobilize that investment, whether through public funding, through repayable finance, or a mixture of both. We can talk, but we need action. We must back our talk with actions and the needed commitment it deserves. We know the problems and we know many of the solutions. Ultimately, if we want a steep change towards universal access to water and sanitation services, then we need governments to prioritize the sector, to provide strong political leadership from the highest levels. And we need consistent finance for a number of years. This is what successful countries have done to achieve universal access. Additional investments in WASH are possible only if the politicians, like us, are convinced and are willing to provide strong, single-minded leadership. As I conclude, I call for a strengthening of the Africa Water Facility, AWF of AMCAO, and the Africa Urban Sanitation Investment Fund, AUSIF, both hosted by the Africa Development Bank, and an increasing focus on mobilizing local resources for investment into the WASH sector. It is impossible to make any meaningful progress without looking internally at how we can tap the opportunities that exist in the continent's private sector and other avenues to improve financing. Finally, I want to thank SWA, AMCAO, and other partners for the opportunity to address this distinguished group and for all the hard work in organizing this meeting and the other advocacy and sharing activities. This has shown that we can still organize a conference even in the midst of a pandemic. We now have to show that we too can step up to revitalize this sector, to respond to and recover from this pandemic, and to build a strong and resilient sector that delivers WASH to everyone, everywhere on the continent. I thank you for your attention, and I know that together we will actually attain our vision of leaving no one behind in the provision of WASH. Thank you.
Thank you so much, Honorable Minister, for your kind words and for your inspiring remarks. We are approaching the very end of this meeting, and also thank you for your participation. And let me now hand over the floor to Dr. Patrick Moriarty, who is the chair of SWA Steering Committee, to give the final vote of thanks. Patrick, over to you.
Great. Thank you so much, Katerina. And so, Excellencies, Honourable Ministers, friends, colleagues, as Katerina said, it falls to me as the chair of SWA's steering committee to bring these great couple of hours of sharing and learning to an end. And so I would, above all and on behalf of all of us, like to add to the Honourable Minister's words in thanking all of you, our speakers. And above all, I'd like to thank you, the ministers, for whom this webinar was created. The Ministers of Finance, of Health, of Water, of Planning, who've joined us today. Sanitation and Water for All is nothing without our members. And you, ministers, are our most important members. All of us look to you for your leadership. We've heard 2 hours of excellent discussion about the current state of progress of the sector in these challenging times. We know that we face a huge challenge in financing our shared goal of water, sanitation and hygiene for everyone, everywhere and forever by 2030. Yet we know that we can do it. We've heard how today from fellow ministers who are doing it. And we've heard about the excellent examples from the recent SWA financing book. But I'd like to emphasize one thing before we move to close the meeting. that yes, there are solutions to finance, how to finance the sector, to how to make it productive and eventually self-supporting. But these will only follow your lead. The sector is in desperate need of strong, high-level, visionary political leadership. We can't fail because of lack of absorption capacity within the sector. We have to find ways to make the sector investable. And speaking particularly to ministers responsible for water and sanitation and hygiene, this is where we look for your leadership. We, all the other members of SWA, commit to following that lead and to supporting you in whatever ways we can. And that's why creating a strong and investable WASH systems and mobilizing the necessary finances to it are the third objective of our new strategy. It's at the heart of what we do. And so thanks again to everyone who joined from all over the world. Thank you to the excellent moderators, to Canisius, Kanangiri of AMCAO, and to SWA's Katerina. Thank you to Katerina and the SWA team, the Secretariat, for putting this whole meeting together, to Spark Street, who provided the great interactive platform, and to the interpreters. This was the first of 3 finance ministers' meetings. There are still 2 to go, so please do join our Latin America and Caribbean and Asia finance ministers' meetings coming up in the next couple of weeks. And at this point, I'd like to leave you with a very short video inviting you to join us at the next sector ministers' meeting in Indonesia in 2021. The videos makes that invitation on behalf of the Honourable Suharto Monoarfa, Minister of National Development Planning of Indonesia. Goodbye and thank you very much.
And gentlemen, the participants of 2020 Finance Minister meeting, with spirit and commitment to achieve SDGs goal, hereby I am delighted to announce that the government of Indonesia will host the next sector minister meeting of SWA during the last quarter of 2021. This upcoming biannual event of SWA is a continuation from previous sectors meeting, which was held at Costa Rica in 2019. The event will be an opportunity for ministers responsible for water, sanitation, and hygiene to share and learn from others' country experiences and to renew and to strengthen our commitment towards provision of water and sanitation for all.
you.